All right, welcome. This is the webinar for the Executive Master's MHA program. My name is Jeff McCullough. I'm a professor of health management and policy. I teach finance in the program, and I'm also the program co-director. I'm going to give a quick overview of the program. What we're going to do is first I'm going to tell you a little bit about sort of what is the MHA, who it's a good fit for, or what it's a good fit for. It is absolutely essential that if you're thinking about going and getting a professional degree, that it is a good match for you and what you want to do with your career. After that, I'm going to talk to you a little bit about why you should be coming to Michigan. If you want an MHA, this is the place you want to go. All right, so someone off screen is going to be advancing the slides for me. So next slide. All right, so our program implements a multidisciplinary curriculum that reflects leading practices in the field, integrates management and policy, bridges research, teaching, and practice. And ultimately, like the essential thing here is that we want to prepare our students for successful careers. And this is something we've been doing for decades. We have alumni holding leadership positions throughout the US and globally. All right, so what is the MHSA? Hopefully you already know, but if not, it's a Master's in Health Services Administration. It's often, everyone else pretty much calls it an MHA. We are cooler because we added a letter. We're going to be teaching you things about organization and finance and delivery and management of healthcare, things that in many ways are like an MBA, but we're going to be doing this in a way that is customized for healthcare, and we bring kind of the unique institutional and payment and policy features that is sort of integrated into our curriculum, and to be successful in that industry, these are these are things you will need to understand. All right, and we get the people who apply. It is a diverse set of backgrounds, which is part of what makes this fun. But there are a few camps that are most common. So usually between maybe a quarter and half of the students are clinicians, often physicians, but other types of healthcare professionals. So people who've been doing clinical care or allied health services in the healthcare environment, in a provider environment, who are looking to move into leadership roles. We get a fair number of people that work in health systems as administrators who want to advance their career to the next level. And then we also get, this is sort of the hardest to define, working professionals who are looking to enter the healthcare industry. Sometimes we've had people sort of coming from tech, the auto industry, manufacturing engineers, a few art-focused people even. Like, it has been sort of, it ends up being an interesting group that applies in that category. And if you are looking to move into the healthcare industry, this is a good degree for you. All right, so where do our graduates tend to work? The most common, and again, there's quite a wide variety, but the biggest single outlet for our students is healthcare delivery organizations, often integrated delivery systems, taking on management or leadership roles. We also place students in insurance organizations. A fair number of students are either already in or moving into consulting, often consulting those same industries. And then I've had a number of students who work at device companies. Every now and then we've had a few in the exec program who move into the pharmaceutical industry, or there are a fair number of people who work for state governments, policy organizations, think tanks, and so on. So if you're in one of these organizations, you want to be having sort of experience in management, business, strategy of healthcare, this is sort of an appropriate match. Things where, there are aspects of healthcare where this isn't the ideal degree. I'll mention that if you wanted to be a marketing executive at a drug company, you really should be going and getting an MBA for that. There are a few roles where, that would be a better match for you. Our program has been ranked at or near the top every year since '93 when they started ranking MHA programs. And we've been recognized for our excellence in sort of research and teaching, theory and practice. And not only are these things that we're teaching, but we are providing sort of we're assisting students in developing valuable lifelong relationships. So your connections with your peers, with your fellow alumni, those are going to be things that remain with you and are of asset to you throughout your careers. All right, so now I'm going to launch into, hopefully this is, the MHA is something that is a good fit for you. I'm going to tell you why you should be coming to Michigan, and there are basically 3 sets of reasons. I'm going to talk about our instruction and curriculum, and there are some important distinctions between our programs and I think every other program out there. I'm going to brag a bit about our faculty, and then I'm going to brag some more about our alumni. So we offer synchronous education, and this is essential when you're doing executive education. We are talking about distance-based education, and that is a challenge. It is easier to do when everyone's on campus full-time and present. And most places are going to be offering, and I've done this before I moved to Michigan, asynchronous education, so pre-recorded material over PowerPoints. If I am giving a lecture, my students are usually on site for 3-day visits twice a semester. And then when we're online at night or weeks that you're not on campus, we're going to be online at the same time. So our distance-based education is synchronous. And what that means is if I am giving a lecture in my finance course, if I'm talking about how to do a net present value or talking about how to value mergers, my students can stop me and ask questions in real time. And I get to stop and ask if my students have questions or they understand me. I taught the same class in an asynchronous format. I posted these things up. I saw if students got the right answers to the problem set, and it looked like they were all getting it. It was fine. I started teaching this in a synchronous environment, and I knew this was going to happen some, but it was astounding how frequently the students were understanding my point or needed clarification. So I think this is a huge asset for the quality of our education. Now, it does come with some challenges. It is going to be more demanding on your schedule. We can't market to this program to people on the opposite side of the earth. From a business case, that was great at other institutions. But if we want to give good quality health management education, this is important. And it isn't just about the relationship between the professor and the student. So we are going to develop you as a cohort. And what this means is you're going to be working a lot with your fellow students. And when it comes to executive education, being in the room with people who are physicians, healthcare administrators, someone who works in finance, they are able to bring their perspective, say, to my finance class. So often I'm talking about payment incentives, and I can have doctors in the room talking about when they've got a relationship with an insurer, an employer that follows those patterns, like how it works in the real world. Last semester, I taught finance to our execs, and I had a student who was an attorney for a health system, and they had just finished doing a merger, a large hospital merger, and he was able to provide just sort of fantastic detail about the real world practical issues in a merger, what that did to strategy, where they used consultants, where they talked to the finance people. And that makes, you learn a lot from your students. And every class, we typically find, even those without sort of strong healthcare backgrounds, I've had people from outside of healthcare where some chunk of the class or some subset of the classes, their expertise has been relevant. So I had someone who worked in manufacturing. I think he had an industrial engineering background. I talked a little bit about finance in the pharmaceutical industry. He actually had fantastic insights into that. This was about 3 years ago. So every student ends up bringing something to the table that's going to enhance the class, and you're going to learn from them. So we really try to take advantage of that. And doing this in a synchronous fashion means you're going to learn from your fellow students, and you're going to develop closer professional networks that you're going to carry with you through the rest of your career. All right, so next I'm going to talk about the timing and structure. I mentioned some of this before, but it's a 20-month program, so that's 5 semesters. We're keeping you over one summer. The intensity of it is a little lighter than it would be in, if you're taking a 4-course load. If you're a full-time on-campus student, it's going to average out to something closer to 3 courses a semester. So we're trying to set this up in a way that streamlines it for working professionals. In most semesters, you'll be on campus 2 times. And that's usually Thursday to Saturday. So you'll get sort of some intensive blocks of teaching then, and those are really valuable. And then in the weeks you're not here, it'll be about twice a night. So this is really a challenge for scheduling, but we also recognize that, there's a lot of value in being there every time, and most people are there the vast majority of time. And everyone's there most of the time. But we recognize that you're going to have schedules that we can't move around. And everything is going to be recorded and documented. So if you miss it, you can catch up. We also post which nights you've got to block off. We tell you that way in advance. When you need to be on campus, that is set in stone before you ever show up. So we do work hard to sort of make it easy for you to plan and schedule. And we work hard to recognize that you're not always going to be able to be on campus. So we're going to record it and help you get caught up and take advantage of this, even when it doesn't fit your schedule. All right, so we talked a little bit about how often you're here. What are we going to teach you online? Or if you go to our website and poke around a bit, you can find every single class and with descriptions of them. But here's what we're going to do. We are going to be teaching you things like the business and conceptual fundamentals, things like operations, accounting, finance, also things like statistics and economics that are a little more fundamental. And those would be things that you'd always get in, say, an MBA program, or most of that you get in MPH, Masters in Public Health with a health policy focus. So all of that is essential, but we're also going to be teaching you, we're going to teach you about health policy. We're going to teach you about how the insurance works, what its impacts are for payment and incentives, things that are just essential to healthcare and different. And throughout the curriculum, we are going to be linking things together. We also are going to teach you a fair amount about kind of quality management, quality measurement, and improvement. And then underneath all this is sort of meant to be preparing you for management and leadership roles in the healthcare industry. So there's more detail on what classes are in there. We try very hard to tailor that to our students' careers. And we also want to keep it streamlined so that working professionals are not spending forever in school. Right now, I think we're at 45 credits, and I can't guarantee it yet. There are some hoops to jump through. But I think I'll have that squeezed down to 39 credits by the time you guys graduate. All right, now's where I get to tell you about just how fantastic our faculty are. I, of course, am completely unbiased in this. So one of the things that really matters is we have 20 or almost 28 core faculty members. The number moves around a little, with expertise in economics, law, management, finance, and accounting. We've got experts in a broad range of fields. There are very few health policy or management programs that are able to that sort of have that many experts and high quality faculty. There are a lot of programs that have good people, but there are very few that kind of have that depth. And the quality of education we provide is usually better when we're able to bring someone who's sort of leading this field as a professor. Now, there are some topics, like I'm very, of course, unbiased again, I'm very qualified to teach corporate finance and healthcare, but there are all kinds of practical issues about healthcare management that I don't have that right background and our faculty might not. So we have another 38 faculty, only if you don't have that many classes, a few of whom will be essential for your education in the exec mass program, but we're able to bring in other faculty who have experience in practice. And I'm going to give you some examples. So I'd already mentioned a little bit that I teach probably several times that I teach healthcare finance. So things like merger valuation is an important aspect of this class, and I'm going to teach a bunch of tools and how you do stuff in finance, often with numbers or data. But then I'm going to be moving on to mergers are sort of a fantastic example. They tie together many of the tools that you use in other healthcare settings. They're also the rate of mergers and acquisitions over the last 5 years has just been astounding. Hospitals across hospitals with docs, also a lot of the intermediaries related to pharmaceutical distribution and the insurance industry. So this has been an incredibly important topic. So this is something, not only do I teach it, I do research on this, and I work with often state attorney generals, but sometimes other parties in actual antitrust litigation. So this is a merger, something happens with a merger of the government or agency is stepping in to block things. And this is really valuable. Now, at one level, I get paid as a consultant, so that's great. But I'm able to get access to details that I would never see as a professor. Subpoenaed information, I'm not going to put that in my slides, of course. So I'm seeing kind of the actual negotiation process, talking to people involved in it, talking to the regulators. That brings a lot of, and again, some of it is confidential, but I am able to bring a lot of detail to my class and do a better job of teaching these topics. I also, and this is a little less relevant to finance, do a lot of work on artificial intelligence in healthcare and machine learning. I have quite a few projects on pharmaceutical policy, drug pricing, drug advertising, and so on. Now, I'm going to do a few faculty as examples. All of them are going to be looked up on our website, but Seth Wolk is my co-director for the Executive Master's Program. He's an alumnus and former CMO of Spectrum Health, and was also, I think he just stopped practicing, a vascular surgeon. So this is someone who went through our Executive Master's Program. He sort of moved into leadership and management roles in a number of institutions, and he's coming back and sort of sharing his experience in kind of management and leadership classes with our current students. And this is it's an example of how we're going to bring valuable expertise outside of the normal academic range that you see from professors, and kind of a success story of how our students have sort of done well and come back and helped other students. Malik Joshi is another example. He's an alumnus and from the Executive Master's Program, and he comes back and teaches healthcare quality, performance measurement, and improvement. And he's the CEO of Meritus Health, which I believe is a Maryland-based large integrated delivery system. So he's got just a wealth of experience. He's come from where you're coming from. And he does a great job of teaching, and he is just very generous with his time. So people like Seth and Malik are just, they are a fantastic resource for us as faculty and for our students as well. Denise Anthony, she teaches our healthcare systems course. Her PhD is in sociology and has a strong focus on sort of management, organizations, and technology. And she probably has quite a few more roles than this, but she's very moment working kind of with state governments on payment policy issues and trying to help shape that. And she's really an expert on issues of sort of trust and privacy in healthcare and how those things relate to technology as well. And she is an amazing teacher and colleague. All right, so those are all examples of every faculty member that we have. They are leading their field in research. I mean, they're full-time faculty that are researchers. They're not just studying this in a dismissively academic way. They're also engaged in sort of the application or practice of these things in the real world. And that is something we bring to the table when we're teaching our students. All right, now I'm going to tell you about our alumni program. So we have had, I'd mentioned you're going to give value not just out of the faculty, but your fellow students. When you get here, we are going to work to sort of establish connections between you and your fellow students to build those connections. We're going to create some, not quite as many, connections with the cohort in front of you and the one that follows you in the second year of your program. So that's going to be a personal professional network, but just like Seth and Malik, we have a massive alumni organization, one of the largest and oldest health administration alumni associations in the country, and they are filled with people that are able to help our students. I have had and all of our faculty have encountered things like this. I, for example, had a pediatrician that wanted to move into administration at an academic health system. She was thinking of that and of moving into consulting, and she wanted to speak with other pediatricians who had similar professional backgrounds. I didn't know any off the top of my head, but I went and talked to our staff that sort of are better at keeping track of our alumni, and we were able to very quickly connect her to multiple people who had made similar transitions in our program. I've had people who want to move from management or get engaged in policy issues, again, with very specific kind of transitions or even regions of the country. We were able to put them in touch with people that were able to help them. So this is just a massive group of people across the country and throughout the world that, not every one of them, but they are a fantastic resource for our students. All right, our alumni are located coast to coast. A little more concentration in the Midwest. It's a good, wholesome place. But it is, they come from a lot of backgrounds. They're present in every state of the country, and it is tremendous the generosity that they show to our kind of students and our alumni. And this is just, I'm not going to go through these, but examples of careers that our students have gone on to. It's nice to brag about the kind of the CEOs or presidents. That sounds flashy, but there are just so many students who have sort of moved through a wide range of positions, and they're making a difference all throughout the healthcare industry in the country. And that is just a tremendous resource for our students. And this is our last graduating cohort. We're getting close to setting another one off. All right, so that is my overview of the program and why you absolutely should be coming to Michigan. And I would be delighted to take your questions. Now, when you come here and you're teaching a class, we will get set up on everyone's computer things where we can directly interact with voice and video, and it'll be a much smoother interaction than through the chat function. Although a lot of students do chat questions while I'm talking in a lecture, for example. So, all right, so while we're waiting for that, I'll go over a couple of things that often come up. We do require a GRE for our program. However, we are pretty generous with GRE waivers. If you want one, the main thing that we're trying to do with our GRE waiver is we're really trying to screen on the basis of, is a student, we're really looking for a little bit of math or quant or statistics background. And this is not a math-heavy program by any means, but both here and at other programs, one of the things that sort of makes a difference in success is just sort of a really basic willingness to work with statistics. And here I'm talking like, if you can take an average and a standard deviation, that's most of what we're looking for, if that doesn't scare you away. So putting in, like, what we're going to want is to see what in your background sort of shows that that's not going to be a problem. So the bar isn't super high, but it is an important issue. All right, we've had a question about scholarships that was on the chat function. So we do not have much scholarship money available for the executive program. You can ask for it. We have occasionally been able to grant it. And this is something that we are actually working to change to create more. I think there's a little bit of you call something an executive program, and people who aren't engaged with it thinks everyone's like an affluent CEO or something. And that is and we have a few of those, but that is very much not the case. We do have a lot of students who I think are deserving, and we are trying to bring more resources. But the truth is, there's not a lot of resources for scholarships for this program, but we'll try to work with you. All right, so we do not require interviews for the admissions process. Although we quite often get students that would like to talk to, and off camera sitting here who's relaying the questions to me is Caitlin, who is our program administrator, and also to me. So if you'd like to talk to us about the program, you should absolutely reach out. Caitlin will put her email address up there. I'm happy to talk to students as well, but we don't formally require an interview for admissions program.
Differences between.
All right, so the University of Michigan has a brand new MPH program that's online and offered through Coursera. The Coursera MPH, and I'm going to start teaching in that one also in probably about October, the coming October, so I don't have a lot of experience with it. But that is meant to be a very generalist MPH degree. It's meant to cover everything from not just, they give some of our health management kind of offerings, but they also have you take nutrition, health behavior and health education, epidemiology, biostatistics. Every single program, you're sort of getting a smattering of every single program in the school across all departments. Whereas, and that for some people that might be a very good thing, but if what you're looking to do is sort of business and healthcare, or even in some ways we are more focused on policy, many aspects of healthcare policy than the generalist MPH. So if you are looking to move kind of those things we went over in the beginning of our course, of our program, this program is going to be much more tightly tied to to those career paths than the Coursera program. Now, in the long run, we might actually, I'm currently exploring ways to sort of integrate some of that technology into our teaching, maybe create some more flexibility for our students. But they do have a different purpose. That Coursera program is a much more general program. And we had a question about electives. There are no electives in the Executive Master's MHSA. Whereas if you take the Coursera program, you'll have more choices and more electives. You won't be able to take all the classes. A huge chunk of the classes we teach in our program will not be offered in Coursera, at least for this foreseeable future, but you will have much more flexibility. And that is just, it's something we're looking to improve, but by streamlining it and trying to make it work for working professionals, we are not going to give you much in the way of choice. We might offer, the next cohort might be the first one to get any electives at all, but that's a big maybe. So. I should mention the application process. The deadline is in July, so July 1, and I recommend applying early and often. There are just some bureaucratic issues with like uploading and validating transcripts, not about our program, but just sort of the way the universities and kind of national admissions processes work. You'll probably find there are a few steps that take longer than you'd expect. So shoot for being done more like June 1st than July 1st, but we've covered the We've covered the most common questions, but I'm more than happy to stay on and do more Q&A.
You have a question? I don't know if you can hear me or not.
All right, we can kind of hear you.
Hi, this is John Bergman. I actually came and visited with you over the summer, this past summer,
Yeah.
or the fall, and I had a question regarding tuition. Has anybody ever set up a direct pay from hospital system to pay tuition?
All right, and I'm getting from off camera a nod that that is a doable thing. And we definitely have some of our students who get, like, their employer is paying for it. I don't personally know about the direct pay thing, but Caitlin was nodding her head that we do that. So that is, so yes.
Thank you.
And I think there are just sort of past students, if it's sort of a variety of employers that have been willing or able to pay for that. And I'm not, to the best of my knowledge, we've always been able to work that out, or it's a standard-ish thing. Number of students per cohort. Those have ranged from a low of about 12 to a high of about 25. We are usually shooting for about 20 students a cohort. But so it's usually 20 plus or minus 5.
Jacob, do our students commonly work 40 hours a week, or is it more often associated with people working less?
I think our average student works at least 40 hours a week. And there are some that don't. But I think the vast majority of our students are working full-time jobs, and some of them full-time jobs that require more than 40 hours a week. So now I'll say every student we have at some point or another finds juggling job life and family and our program to be a challenge, but it's almost 100% on-time graduation every student every year. So it's hard, but this is very much doable for working professionals with full-time jobs. So they are able to make it work.
So we have our class with JHS.
Oh, is that the capstone?
Mm-hmm.
All right. So someone asked about a practicum requirement. And at the end of our program, we have something that we call a capstone that's meant sort of to, there's a little bit of a difference in how this is done. This sort of thing is done with the residential students. But this is sort of meant to integrate the different aspects of kind of material from kind of the totality of what we've taught you and bring it to some kind of application that relates to your career path or the industry. I happen to not know very much about that course personally. I know a lot more about, there's some of the courses I know a lot about, but that's not one of them. But all of our degrees have some kind of integrative capstone that's kind of meant to transition what you're doing into the real world.
How soon after?
So we're usually pretty quick in our turnaround in giving a response. However, like that thing I mentioned earlier about some of the forms and stuff taking a while to sort of clear, like once it gets to me, I usually make my decisions pretty quickly and you hear fairly soon after. But sometimes it seems a little longer to the students who've applied. So once the thing's worked through, I've made my decision within a week for most students. And they hear about it within a week of that probably. Is that sound fair? If you apply at a really unusual time of the year, they get a little lost. I won't guarantee that I'm that quick on the turnaround, but that's usually about how fast we're able to work. And I will say we are tremendously cheaper than an MBA program. We are at, I'm looking at my frequently asked questions sheet. So in-state, we're a little under 10 grand a semester, out of state about 16. Total cost of about 135 at our MBA program. That's across 4 semesters for them. So it's an incredible bargain. I want a 99 cent to be at the end of our price, but the Board of Regents does not let me do that sort of thing. I have no idea.
We typically get.
All right, Caitlin tells me we typically get about 85. They all kind of go, I see them all, but I've known that number in June. I blacked it out. We usually get about 85 applications. There's a lot of, we get a lot more students who sort of start and then start talking to us, and there's a bit of self-selection in who finishes, like the students who are a better fit are the ones who see it through. So if you have questions, so hopefully I answered your questions and you've decided that the MHA is right for you and you absolutely want to come to Michigan for our bargain priced education, even though they don't let me set the prices. And if you have further questions, you should reach out to Caitlin, reach out to me, copy us both, so because I'm an absent-minded professor. And we would be happy to talk to you more, and hopefully I will be seeing you guys next year.